all ramifications of our life, we need certain things that we need to put in place. Without wasting much of our time, we're having a wonderful section today, like I said. I'll be looking at fitness and wellness, a wellness journey, protecting your health in the 21st century. Let's clap for Jesus. We want to talk about our health. What are we doing? It's also part of, he said, health is wealth. It's also part of the journey as a Christian. And while I invite my wonderful doctor, a friend, Dr. Macaulay Victor, I'm just going to tell you a brief about him before he comes on the podium. Okay, a brief biography about Dr. Victor. Dr. Macaulay Victor is a medical doctor, a wellness advocate, and the founder of Dr. Macx Health Support Community on YouTube. Hallelujah. Let's clap for Jesus. His name is Dr. Macaulay Victor, but Dr. Macx Health Wellness is spelled M-A-C-X. I've seen that. Okay, M-A-C-X, so that we can have an understanding. If you want to go and search him on YouTube, on the Health Support Community on YouTube. He's currently in Lagos, Nigeria, after graduating from the College of Nursing at the University of First Choice. How many of you know University of First Choice? You don't know University of First Choice? So sorry, which was you? I like you to pronounce the university, but the only University of First Choice we know ourselves, I mean, Unilag. Hallelujah. Unilag are not nice. Let me see. Hallelujah. On the lighter one, just joking. He has explored his interest in helping people maintain overall wellness through health education and aim at influencing daily health practices in life via his health support community. Apart from carrying out health checks with brands like Unilever, Nigeria, he is also a mental health enthusiast. So all the streets, battling of all the streets, if you have questions, start writing them down. Helping young people navigate through the myriad of common challenges in life, especially psychosocial aspect of dating, while it promotes psychosocial aspect of dating. In that aspect, you also tell us more about it. While it promotes his gospel music brand. You can see this man is multi-talented. Let us clap for Jesus. Church, without wasting much of our time, please welcome Dr. Macaulay Victor. So we try this section for the next 1 hour, so let's be attentive and listen. God bless you.
Recording has started already. Okay.
Good morning, church.
You said you should record. Recording has started already, so you can.
Good to see everyone here. I like the energy,
Signals,
and smiles. So that's good. So as I've been introduced already, please you can have your seats. So as I've been introduced, I'm Dr. Macaulay. But most of the time I go by Dr. Macx, especially online, my health pages and all that. It's not often that I get to be on stage in church to give a health talk. Like rightly pointed out, I have a gospel music brand, still the same Dr. Macx. So most times when I'm on stage in church, it's to minister. So this is actually a first for me. Okay. So we'll be talking about health. Now, the truth about it is, one of the reasons I decided to talk to people about health is I realized a few things. Number one, and this started when one day I went to see the doctor when I was getting these glasses, right? So even if I'm a doctor, I can't just create my own glasses and I still have to see another doctor. So the doctor was telling me, I complained about something and then he mentioned, okay, what am I doing regarding my own blood pressure and all that. He said, am I doing exercise? And for the first time it hits me. Yes, I've always told people to do exercise too, even as a doctor, but which kind of exercise? Right? Do I just go and register in the gym, 35,000 per month? Am I sure that will work? Or do I just hit the streets, wear my sneakers and start running up and down? For how long do I run? So many questions that come to my mind. That's when I realized a lot of times people get, and this this doctor was even nice because most of the time the average doctor will tell you take your drug, bye bye, come back in 2 months. Right? Am I saying the truth? They don't really have time to ask you whether you don't exercise or anything like that. They just give you drugs and tell you bye bye because they have so much work to do. And so that's when I realized that first of all, a lot of people don't have enough information, and to make it worse, when they see a doctor, the doctor does not have enough time to properly break things down. They don't have an avenue to ask questions and really get the answers they need. But more importantly, a lot of the common medical problems, think of it, you hear that someone just went out to buy Gary, you know, he greeted this person, greeted that person, all of a sudden it's long, and that was the end. And then they call it evil arrow, right? Don't get me wrong, it could be an evil arrow, right? But it could also be a heart attack because this person had a very high blood pressure. At work last week, we saw a security man whose blood pressure was 250/150. Now, someone said, wow, that person understands it, right? Normally, your blood pressure should not go above 130/80, right? This guy's one was 250/150. If that kind of person should just drop one day, it's not an evil arrow. We say someone who had a leg sore, it was somewhere in the east, and then they said he stepped on poison, he stepped on one charm, he stepped on this. No problem, I'm a Christian, so I don't doubt that these things exist. When he saw the doctor, blood sugar very high, blood pressure very high. So why won't he have a sore? Right, so apparently a lot of people don't know that high blood pressure and high blood sugar puts you at risk of having a sore. Now the sore can get so bad that they have to cut off the leg because it starts decaying. On the other side, it looks like, oh, he stepped on juju. No, yeah, maybe he could have stepped on juju, but can we control his blood sugar and control his blood pressure and see truly if we've done everything? And that's how you know it's spiritual, right? When you've done everything medically about the situation and it's still not making sense, even the doctor will tell you, at this point we don't understand what is going on, right? The doctor will tell you. But when you've not done anything like that, just say it's spiritual. That's right. And so eventually that guy is probably going to have his leg amputated, right? Because that sore had gotten so bad. And it is very common in people with diabetes, right? High blood sugar. It's very common. Unfortunately, he was busy chasing herbal treatments up and down instead of controlling the blood sugar, which would have made things easy. So that's where I'm going, that a lot of, of course, there's also stroke, right? Someone woke up and the person cannot move one side of their body, or someone just woke up and the person could not even move at all. And then we also have the issue of young people coming today with high blood pressure and, you know, kidney issues and all of this. And it all points back to simple daily habits. Things that if you know, you can just start doing it today, little by little, to protect your health. Because I'll tell you one thing, I don't think there was anyone who was born 100 kg, right? No, that fact, the person was adding in little by little. I don't think there's anyone who was born with blood pressure that was very, very high. No, it was going high little by little. So something that has now happened little by little over 10, 15, 20 years, you think you can reverse it in one day? No, it will have caused so much damage. So how about we now change our approach and start controlling it little by little over the years? And that's where this education comes in. To say all those terrible problems that build up over years, how do we find ways to counter those little steps such that it's not building up? And that's where health education is important. Now, the first, the title here says protecting your health in the 21st century. Just randomly, what are the things that are peculiar about the 21st century? If anyone can just shout it out. Stress. Thank you. God bless you. Stress. Everybody is stressing you. From your landlord to the security man, to the bus driver, to LASMA, to police, to get to work. Your boss is stressing you. And if you are not lucky, you have the husband or a wife who is also contributing. That one, I don't even know what to say to you. And I've seen a patient like that. He came in, he said, oh, my chest, my chest, my chest. Okay, fine, let him lie down. BP was not so bad, a little bit high. He came with his wife and stepdaughter. After a while, he was now relaxing. They both went outside. He now told the doctor, I'm actually fine. But you see, at home, they want to kill me. They are always fighting, always fighting. So today, I decided to fake heart attack so that they can rush me to the hospital and I can rest. That was the reason why he came to the hospital. I said, well, he has a valid point. Before they truly actually kill him, let him rest in the hospital. And so these things actually play a role, right? Can I get one more? Any other thing about 21st century? Food, sleep, thank you. Food and sleep. These are things that I'm about to expound on right now, right? Food, everybody is eating on the go, quickly. Nobody really has time to cook. You know, when Daddy Gio said, don't marry a wife who cannot cook, in my mind I was like, Daddy Gio has broken a table, you know, because I know that there are a lot of working class women that will say, where do you want me to find the time and all that? The only thing I will say is that at least one person in the house will be able to cook. Because he has a point. You know, I would tell you one of the risks of eating outside. Everybody knows ulcer, right? So ulcer is caused commonly by an infection called H. pylori, right? Helicobacter pylori infection. It is most often gotten through food. It is fecal-oral. In other words, feces, probably on someone's hand. The infection was there, it now entered the food. And I'll tell you something I have seen before, real life, outside. Saw a woman who was selling food, and she was with her baby. And the baby just pooped, right? And this is literally what the woman did. She was holding the baby like this, right? Holding the baby here. There was water here. And all the woman did was she carried the water, washed the baby pom pom, washed the baby pom pom. You know what she did after that? And she continued serving food. That's all. That's all she did. She just cleaned her body. So when you are eating outside, even if it is the big name, the Chicken Republic, you don't know what is happening at the back, right? And that's the most common way people get that infection that causes ulcer. And what's unfortunate is that it does not trigger symptoms immediately. The infection will take time to be making a hole in the stomach, little by little. So when the hole gets to a particular point, that you will now start feeling the ulcer pain. So it can be there, burrowing into the stomach for 5 years. The person will not know. So generally, H. pylori infection is more common in people who eat outside. So when the GO said, I was like, yes, a point. So it's better you cook your food by yourself. At least you know. I don't believe anybody here will be in their right mind will just go to the toilet and then use that same hand to cook food. Right? Wash your hands. But for people outside, they don't have time anymore. Customers are plenty. Okay. So we've already itemized some of the common issues about the 21st century. We've said lack of sleep. So you can, okay, yeah, so that's the slide. So sedentary lifestyle, everybody's always sitting down, right? Just enjoying her life, at least in her mind, that's what she thought she was doing, right? So we have a situation where it's now being normalized. And people don't understand, when people say alcohol, drugs, they are called psychoactive, as in they mess with your brain. They disturb, your brain is supposed to be functioning like this, right? When you take any of those things, from alcohol to drug, whatever it is, your brain is supposed to be going like this. It will make your brain like that's what they're thinking. So it's an issue too, right? Misinformation, people are getting, everybody is now Dr. Google, you know, open Google, whatever you see. When people don't know that if you type anything on Google, Google will go and look for that thing for you and show you what you want. Say, is smoking good for the health? Google will look for one study that they did in one corner of the world. Say, smoking supports your well-being. It will show you. right? So everybody's Dr. Google, misinformation. There's that. I remember when I was in school then, if the consultant tells you to go and prepare for a topic, and you come back, and the information you give, you can open Google and see if you're in trouble. Because as doctors, we are trained to be able to get information from more credible sources. Okay? So social media overuse, that one has its own issues. Poor relationships that affects mental health. People are no longer communicating. You find 10 people in a room and everybody's like this. Talk to the person beside you. And even here, how many people have greeted the person sitting next to them? You said hi at the very least. If you've not said hi, just say hi. No, it's not too much, just say hi. Hi. Yeah. Right? Oh, I know you can get uncomfortable. I also don't like it too when some pastors come and they say, tell your neighbor, leave my neighbor alone. It's not, everybody's looking for a magic bullet, right? That's the special thing. There's none. Tell people, if you think of a car, what does a car do? It takes you from one place to another. That's what it does. Think of everything you do to maintain a car. It's not just fuel. You can't just buy fuel and say, well, I bought fuel, why did the car spoil? No. Fuel, engine oil, brake oil, water, servicing, so many things that you do, and all the car does is transportation. How much more you, the human being, you think, you transport yourself, you move around, you eat food, you digest it, you work. So you should know that if you are looking for some shortcut to wellness, you are just deceiving yourself. It does not exist. A friend of mine said she was going through, she had lost someone, and she was going through a tough phase, and she was at the hospital. So I asked her, sorry, I hope you are taking it easy, I hope you are eating. She said, oh, I've not eaten for like 3 days, but I've been using Well Woman. Well Woman, if you know it is a drug, I'm like, it does not work that way. You don't exactly throw away food and start taking Well Woman as a replacement. There is no shortcut. Alright? You need to eat the actual food. That's where the macronutrients are coming from. So there's no shortcut. It's important that everybody knows that. So that when I start telling you things you need to do, it's not be like, doctor, too much now, I should not do this, I should not do this. No. You are maintaining a system. Your body is the goose that lays the golden egg. You have to maintain it. You have to maintain your brain, you have to maintain your heart, you have to maintain your liver, your kidneys. You have to maintain them. Right? So keep an open mind. And let's start with diet. How do you like rice and plantain? If you are a plantain, there are people who like plantain, and then there are people that in the plantain WhatsApp group, they are the admin of that WhatsApp group. If you are in that category, you don't joke with plantain. Beautiful. So rice and plantain, there are many lovers. That's nice. It's a terrible type of food. Yes, it is bad for your health. Yes, that's the way I want to start. Rice and plantain. Why is it bad? Because rice is carbohydrates, plantain is carbohydrates, and then you now add one small meat. And you know how a lot of us grew up now. In fact, if you have rice and plantain going up, you are even a bit rich. The way a lot of us grew up is a mountain of rice, one meat on top. That's how most people grew up. For rice and plantain, or that mountain of rice you want, it is not healthy. So what would I recommend instead? We are going there. Alright, so next time you see rice and plantain, just think about it twice. I know I've spoiled some people's lunch plans, so that's what it is. Yeah. So, when it comes to diet, 3 things you need to keep in mind. Reduce, restrict, and avoid. Reduce, restrict, and avoid. What are you reducing? When I say reduce, it means don't take it every single day, right? Have some days when you just go off these foods. That's what it means. Just be conscious about not taking it every day. That's reducing it. So fatty foods, fried foods, fried yam, fried akara, fried fish, fried meat, fried egg, fried plantain, fried chicken. All of them in that category. Fries, right? You want to reduce them as much as possible. In fact, fries is a special one. We'll come back to that. For fried foods generally, you want to reduce them. Alright, red meat is basically normal meat, beef, right? You want to reduce it. Yes, it's high in fat, in cholesterol, alright? And that's added to the fact that red meat is generally now being questioned as to whether or not it's related to some cancers. Yes. So, because there is no definitive study yet, but it's something that you want to reduce, mostly because of the cholesterol level in red meat. All right, it's high in cholesterol. For those who don't know what cholesterol is the fat that is inside your blood. And why that fat is dangerous is that whenever you see people who they say just slump, in many cases what happened is that fat in the blood was packing around the heart. It was packing, you know, the blood vessels, they are like small pipes, right? So around the heart, when the fat keeps packing and packing and packing, at some point in time, it's completely blocked and the person drops. Okay? So that's why fat is bad. So red meat, you want to reduce. High fats in animal meat. Okay, yeah, so that's what red meat is, all right? It's high fat animal meat. Then you also want to reduce carbohydrates. And like I said, it's reduced. So you want to make sure that you are not eating carbohydrates every day, which is hard in this part of the world, right? Because we grew up with carbohydrates. Yeah? Which is also the reason why everything, they say Africans have the highest risk. Blood pressure, we have the highest risk. Obesity, we have the highest risk. Stroke, we have the highest risk. Diabetes, we have the highest risk. Because of our diet, it's highly carbohydrate based. Alright, so you want to make sure you are not eating carbohydrates every day. You are not eating fats every day. Alright, something to keep in mind. Next, we talk about restrict. Restrict means that you probably want to do it maybe once in 2 weeks, once in 3 weeks. You are restricting it. Okay? Unlike where you reduce, where you are just not taking it every day. Restricting is more controlled. Alright, and that's for things like junk food, like snacks, soft drinks, energy drinks, okay, caffeine, all of that. And I can go into this a whole lot, but the summary is that it is not healthy for your system on so many levels. It throws your blood sugar up into the sky. When you take, let me just talk on this, right? When you take energy drinks on one hand, what energy drinks you want tell your brain to do is fire, activate everything. Now, if you are using boat and you are running up and down, you can understand. If you are carrying cement, you can understand. But you take an energy drink and then you sit in front of a laptop. So your brain is just telling your body to fire, your heart is firing. What your brain imagines is that you are about to do one serious exercise, right? You're about to do something very physical. And then your body is just firing for nothing. And guess what? It's artificial. So you fire like that, not because the body organically is doing it due to something, no, because of a substance you are taking. Right? And you do that often. So over and over again, your brain keeps telling your body to fire. What do you think will happen when you have to just pump it all the time? You are overwearing your system without even doing anything. You are on your laptop, right? But in your brain and in your body system, you are walking like a jackal. You are running up and down, you are climbing. That is what your brain imagines. Alright, so it will wear out your heart, wear out your cardiovascular system, right? Your blood pressure will shoot up, right? Now, that's one part of the equation. Another thing that is common with energy drinks and soft drinks is the way it shoots up your sugar. God did not make your body in such a way that you should just pack sugar. You know how many cubes of sugar in one bottle of Coke now? I think it's about whether 16 or something like that. It's one crazy number. When God was making Adam, there was a reason why there was no Coke. It's not like God did not know how to make Coke. I hope that you know. If God was making the body so that you can drink Coke, you would have given Adam Coke. So originally, the body was not made to process that. So when you throw that sugar into the bloodstream, what will happen is, the body says, what's going on? Why is there so much sugar here? It will go and pack it up. Right? Which sounds like a good thing, which is normal. But here's what happens over time. Over time, after a while, the body system will feel like, oh, it's like this guy just like throwing sugar inside the blood. Maybe we should not stress ourselves. You know, we're always running around to pack it. It's like maybe there's no problem. Let's just leave the sugar inside the blood. And that's where the problem starts. Because sugar is not meant to be lying around in your blood. No, it's meant to be absorbed into your muscles, into fat cells. Your brain will use the sugar, whatever it is, but it's not meant to be lying around. And that is how people end up with diabetes. So diabetes is basically a situation where there is just sugar floating in your blood causing problems. Because now that the sugar is not absorbed, what will it do? Well, it will go to the eyes, it will cause problem in the eyes. It will go to the kidneys, it will cause problem in the kidneys. It will affect the nervous system. That's why you find out a lot of people who have diabetes, sometimes they have injuries, they don't even know. If you see people like that, right, they can step on a piece of nail and they don't feel it. Why? Because the sugar has destroyed the nervous system. So they don't feel all those things. That's why they can have a sore. The story I was telling you earlier, that person had that sore. Sometimes they don't even feel pain until the sore goes so deep that they have to cut off the leg. Alright? So that is what the sugar does when it is lying around in your system. Why? Because you just kept throwing sugar inside the blood. Right? So people who take sugar soft drinks every day have a 50% higher risk of developing diabetes. Alright, people who take soft drinks every day. So that's why we say restrict it. And then of course, avoid. I don't even need to talk too much. Avoid tobacco, avoid smoking, avoid alcohol. This is not me saying it now because you go to hell, right? Because what will happen, you first of all suffer on death, right? You suffer, yes. Your liver, your lungs, your kidneys, you suffer. You will not die and go to hellfire on top of it. That's what will happen here. So if you are looking for a good reason why you should not smoke and take alcohol, this I believe this is enough. Yeah? So please, it destroys. There is almost no organ that smoking and alcohol does not destroy. And there's usually the question of, oh, what if it's just shisha? Oh, what if it's just marijuana? Oh, they said this one is medically healthy. Listen, right? As long as you are smoking it, it is the only thing that's going to enter your lungs is this oxygen that we cannot see, right? This air around us. Anything apart from that is not going to enter your lungs. It's not. So if it's going there, it's going to cause problem. There's no way around it. Right? So it's just the same, and it is, we all know now of secondhand smoking. So even when someone else is smoking it and you inhale it, to show you how much it is a problem, and you just inhale passively, it still goes and causes problems. Right? So smoking, alcohol, completely avoid. Now I put sausages and corned beef because now sausages and corned beef and all forms of processed meat, alright, it's not limited to corned beef. Processed meat means that it's meat, but you didn't go and buy it by yourself and prepare it at home. You just went to buy the canned version, right? So you don't know what they did in the factory. That's what we call processed meat. Somebody carried the meat to the factory and they did magic on it, and now you're going to eat it. Processed meat has now been linked to colorectal cancer. So for me, I would say as much as possible, avoid sausages and processed meat. And sausages, I speak about it more and I think of ladies, because it's ladies that like shawarma, it's ladies that like, hot dogs, ladies that all those kind of things. In fact, junk food, ladies like junk food more. So just keep that in mind when next your boyfriend or husband buys your shawarma. Yes. So what should you do instead, right? As you grow older, so for the children, right? Let them have the ice cream with some limits, right? But they can have that a bit much more. Why? Because they're running up and down. Have you tried to run up and down with the child before? You will get tired. You don't have the energy. They will use that energy to run up and down. So they can do their carbohydrates, they can do even some junk food. So at next time they can do that more. But as you get older, you want to do more of vegetables and fruits, a whole lot more. That's the one thing that will benefit you the most. Alright, vegetables and fruits. Then when we are talking about protein, right, you want to go for lean protein. An example of lean protein, fish, beautiful. Alright, fish is beautiful any day, anytime. For chicken, the sweet part that most people like is the part that causes problems. You see that skin, when they fry it or they grill it and it's brown and it's shining and it's calling your name, that's the one that usually causes problems. That's the one you're supposed to remove. Alright? So you are meant to do more of chicken breast or turkey breast because it doesn't contain much fat. Okay? You also want to do eggs. Beans, yes, beans contain some carbohydrate, but it's also about 25-30% protein, which is good. Now, another secret about protein is that protein reduces your appetite. So people who are trying to lose weight, I usually recommend combine more protein with vegetables. If you notice, you eat beans, you can just keep drinking water for the rest of the day, right? Because that is the protein in there. It reduces your hunger, it reduces your appetite. Okay, so that's one benefit of protein. So, and what that basically means is that when you are doing more protein, you are not overeating. And we talk about diet. In fact, I think I should just mention it now. There was a time I was discussing with a lady, already looking at the lady, I don't like to judge people, but she looked like someone that she should know that she should be trying to lose weight. Again, this is not me judging now, but when you see some people, you feel like this person better be thinking about to lose weight. You just say it in your mind. Then she told me what she was planning to eat that morning for breakfast. And I was looking for how to tell her that, are you not supposed to be trying to lose weight with what you're about to eat? Like, it's not adding up. Are you trying to add more to what you already have? Like, the point you are getting to, you should be thinking about to reverse, not to move forward. And the excuse she gave me was that, but it's healthy food, it does not matter. Sometimes the problem is you are just eating too much. And there was a lady that, when you enter bus sometimes, there are some people that you just ask God to help you. Like already occupying almost all the space, and she was still, give me chingon, give me sweet. I was this close to telling her, this is why you are fat. This is why this thing that you are about to buy is why you are fat. Stop eating. Just stop eating. Right? Sometimes you just need to stop eating. Stop. Healthy or not, just stop first. Alright, it's very important. The amount of food we eat plays a major role, even if it's healthy. So that's important to note about diet. Okay. So special considerations. For anyone who is trying to lower their blood pressure, dealing with hypertension, please, okay, if possible, do no salt at all. But if not, do a little salt. And here's how you know. If you're trying to control your blood pressure and someone else eats your food and they don't spit it out immediately, then something is wrong, right? How you know you are putting in a very small amount of salt is that if someone else should taste your, did you forget to add salt? Yes. Now that's the kind of food you should be eating that is almost tasteless, that no other person in the house can eat. And the good thing is, especially when you don't want anybody to touch what you are putting in the fridge, it's very good. And it tastes on the tasteless, they talk paper. So that is how, if you're trying to control your blood pressure, your food should be almost tasteless. And it is not a, what's the word? It's not like a punishment, alright? Your tongue will actually adapt to it. Okay, your tongue will adapt to it. So it just takes a while, maybe like a few weeks, and then you get used to it. But in addition, to make your food spicy, you can use herbs. Okay, so anyone who has questions, you should be passing around paper so you can write your questions down. Okay, so low or no salt at all for people trying to control their blood pressure. For diabetes, no refined sugar. So this is where I am saying don't do it at all. All right, on this one, in this special condition for hypertension, no salt. I was going to say that to make your food spicy, you can use herbs. All right, the green pepper and all that, they actually make the food spicy without bringing that salt element. I don't want to go into details of how salt increases blood pressure, but it's a better alternative to just use natural spices. Okay, no, Maggi is the same as salt, but people will ask, can I put salt without Maggi or Maggi without? It's the same thing. Don't bother. Okay. For diabetes, no refined sugar. Refined sugar is soft drinks, juice, and all of them. Even the one that they wrote zero, diet this, zero this. No, it's a lie. I'm telling you now, it's a lie. Yes, they want to sell. They know that there are some of you who still want to drink that juice, but the doctor has told you that you should not drink it, so they now come to tell you, there's another one. This one is for people who are trying to lose weight. It's a lie, right? It is processed, it's refined sugar. There is no way. Most likely they change the name of the sugar and they put it inside the ingredient there somewhere. That's all they do. Alright, so no refined sugar, none at all. For obesity, like I said, you want to calm down, increase vegetables, increase protein above all else. Rest. Poor rest has been increased to high blood pressure. It can be linked to high blood pressure, linked to obesity, linked to belly fat, linked to poor sugar control. So please, we need to rest. Whatever your health goals might be, whatever they might be, if you are not resting, that will be the reason why you've not achieved it. See some ladies who are trying to look, I want to look like this, I want to look like figure 8 and all that. Rest first. Alright? And the minimum sleep you are supposed to get is 7 to 9 hours. Now, every time I say this, I hear, in this Lagos, I wake up at 4 a.m. I get back home at 11 p.m. So, you need to understand something. Right? If I say I will give $20 million to the person here who can hold their urine for the next 2 weeks, that's all. Just hold your urine for the next 2 weeks and I'll give you $20 million. Anybody here who can do that? So you don't negotiate with nature. You don't negotiate with God. Your blood pressure does not care that the reason for the stress is that you are living in Aja and your workplace is in avialble, and that's why it doesn't matter, right? So all the conversations, and I have to tell patients, I cannot be thinking of the drug to give you, thinking of your medical condition, and then you're going to be thinking about the logistics of your personal life, and how you will, no, I can't add that to the things on my mind. So you need to figure out how you will be able to get 7 hours of sleep. Do you need to change your location? Do you need to change your job? Do you need to get some extra certification? You know, there are some people that can enter the workplace at 10 a.m. and nobody will ask them questions. Am I saying the truth? In every workplace, there's a person that can enter at 10, at 11, and nobody's asking them any questions. So do you need to upgrade and get to that level? Do you need to buy a car so that you are not jumping bus? Sometimes just the time you spend waiting at each bus stop, when you have everything together, it's up to 1 hour. Right? So you need to think, what are the things I need to do so that I can eventually get 7 hours of sleep? You cannot be working all your life until you retire, you are not able to sleep for 7 hours. Because by the time you finally retire, all the money you have made for your 35 or 40 years of work, you are carrying it to lose to go and pay doctors to treat you. That is what you will do. Because I can assure you, you don't sleep 7 hours, you are waiting till you retire before you start sleeping 7 hours. Trust me, you have created some problems. That one is sure. You can't sleep 7 hours, you are definitely, and this is something I have seen happen real life. A patient came in, the blood pressure was extremely high. So we gave the first drug, the blood pressure did not come down. Gave the second one, gave the third dose, the blood pressure did not come down. And this man was there in the emergency, and I was like, before Dr. Macaulay starts trending on Twitter, the patient came, he does not, you know how people drag doctors now, he does not know anything, this is that. I was worried. So I called the consultant, that this man, we're giving him 3 drugs, so that blood pressure, when I say his blood pressure is not coming down, like, it was still around 200. The type that is scary that you cannot go and sleep as a doctor because you don't know what you might wake up to. And the consultant said, okay, fine, just give him diazepam injection, let him sleep. Right? That's what diazepam does, it helps you to sleep. And that extra added benefit of sleep brought the blood pressure down. Right? Same thing for the patients. A lot of patients are saying with blood pressure that is hitting almost 200, 250. Right? They always say, I did not sleep well. I had to wake up at 3 a.m. and then get to work. That's the kind of person that can just drop. Right? That is how important sleep is. So 7 hours, you need to plan it. And it cannot be that it's retirement that you now start sleeping 7 hours. Alright? By then it will be too late. So whatever you need to plan, if it's the next 6 months, the next 1 year, the next 2 years, have a plan so that you can eventually sleep 7 hours. Please, it's not too much to ask. Rest is more than sleep, right? Identify things that are stressing you. I already mentioned your workplace, your landlord, whatever it is. Address them. Address them. Some people I also talk to people about relationships sometimes. If you are dating somebody that is stressing you, right? And I once dated someone like that. In fact, once I entered the room, my roommate sees my face. He will say, I don't want to mention her name. He will just say, she's the one, Abby. He could already see, right? I ran away after like 2 weeks of the relationship. Yes, I ran away. I had to man die. I refuse to be stressed, right? So you need to prioritize yourself, all right? Whatever it is that is stressing you, sit down. Don't just ignore it and say, sit down with it. Because one thing you need to keep in mind, your brain does not know if a lion jumps in here and your heart jumps up, right? And you are getting ready to run. Versus when you are thinking about whether or not that guy is cheating. Versus when you are thinking about the email you were supposed to send that you did not send. Versus when you are thinking about the house rent that is coming. Your brain does not know the difference. It does not. As far as it's concerned, for all those problems, you are getting ready to run. Right? So imagine that you are constantly in a state of getting ready to run. Heart is pounding, all your muscles are activated, everything like that. Constantly, all day, all night. Alright? That is a very serious problem. And that's why mental stress is far more dangerous than physical stress. I want to tell people, if I ask you to carry cement, is that up to you? Either you can carry it or you cannot carry it. If you try and want to, before you put it on your body, you will leave it alone, right? But people can sit down, struggling mentally, be thinking, how do I solve this problem for hours, right? That one is more dangerous. Okay, so disengage from work. The brain triggers dangerous responses to long-term stress. That's what I just said. Rest your eyes, okay? This goes to social media, okay? Always on phone, always pressing phone. Ah, you like phone. Jesus Christ. Rest your eyes for so many reasons. And one of them, I'll still probably talk about it, there's a sedentary lifestyle. When you're on your phone, most times you are sitting down. And like they say, sitting is the new smoking. So sitting has become so problematic that it's akin to someone smoking hard drugs. So yes, you are feeling good with yourself. At least you are not that garage boy that is destroying his lungs, smoking his go and all that. But you are sitting down from morning till night. Sorry. Right? So disengage from social media, rest your eyes. Another problem with social media and phones is that so there are some cells that are produced in the brain when it's night time. Those cells tell your brain, okay, it's time to sleep, it's time to rest. The light from your phone tells your brain that it's not yet time. It's not yet time to sleep. So when you are pressing your phone at 9 and you are wondering why you find it hard to sleep, that's the reason why. You're pressing your phone at 10 or 11. Some of you press the phone till you sleep because your brain is just exhausted. Right? That's bad. And what happens is when you don't sleep consistently over and over and over again, what will happen is that your blood pressure will come up little by little, right? But then what will now follow is that for every time your blood pressure is high, it causes certain damages. You know, it's like when the demon said that we'll go outside and find 7 stronger demons and come back. That's what happens with blood pressure. So when the blood pressure comes up, it will go and cause enough damages and say, come, let's come together and increase the blood pressure. So that when you eventually stop doing that thing, it's a lie, that blood pressure is still high. Right? So it's important to note that you need to rest your eyes. Mental health. Evaluate your mental health properly. Alright? We're talking of ADHD, anxiety, depression, and all that. I'm just going to say lightly, there's sadness and there's depression. If you had a bad day, you're feeling sad, that's fine, right? Some people claim that they are depressed. You tell them, come, let me buy you a car. They are already happy. That's not depression. When you go with depression, if you want to know if someone is depressed, tell the person you will give that person what they want most in this life. If that person's mood does not change, then you are more likely dealing with depression. Depression has almost nothing to do with what is happening to the person or any clear-cut issue that you can fix that will change the person's mood. Depression is not like that. The person is just in a state where they are not interested in anything whatsoever. Alright? They are not interested in anything, no matter what it is. So when you see people like that, they are not interested in food, they are not interested in friendships, they don't want to go out, they don't like to read books, they don't watch TV, they're just sitting down from morning to night. That's more likely to be depression, and you need to watch that because the person is sitting down, but because of that state of depression, it's affecting the blood pressure. Alright? And that can be very, very dangerous. Okay? So, exercise. Exercise helps to control blood pressure, it helps to control blood sugar, it protects your heart, improves your mood, it helps to lose weight, and I've said sitting is the new smoking. Alright, so these are some of the benefits of exercise. I would have loved to go in detail into different kinds of exercises for different issues, but that's a very deep conversation. On my YouTube channel, I've had a lot of conversations about exercises for different things, but general principles, right? The standard 150 minutes of physical activity per week. It doesn't matter what your goal is, right? Whether you're trying to lose weight, you don't want to have high blood pressure, you want to protect your heart, whatever it is, you want to control your blood sugar, the minimum you should do of exercise is 150 minutes. That's 2 hours, 30 minutes of exercise per week. And no, you cannot do it at once, straight. No, you have to break it. So it can be 30 minutes for 5 days, all right? It can be 45 minutes for about 2-3 days or so, right? Whatever it is. And it's moderate exercise. So I must explain this. Moderate exercise is a type of exercise you do and you cannot sing, right? So when people ask me that, oh, if I take a stroll to somewhere, is that also exercise? No, because you can take a stroll like this and thank you, Lord, you are not exercising. No, all right? If you are going to exercise, you need to be energetic about it. You will feel that you exercise. If you are going, right? So that is an example of exercise. And you can imagine how hard it will be to sing in that kind of situation. So usually, the mark is for moderate exercise, you will notice that you cannot sing properly when doing the exercise. Then you know, yes, you're actually. So 150 minutes of moderate exercise. So some general types of exercises that are moderate exercise, I just did what we call brisk walking, all right? Brisk walking is probably the easiest almost anybody can do. You don't need a gym, you don't go to your street and do brisk walking. So that people will be looking at you and they'll be thinking you forgot something at home. So, but apart from that, it's very good. Others are cycling, dancing, doing heavy chores, right? You are washing, you are scrubbing the bedroom. If you are doing that for 150 minutes in a week, you are already trying, please. More grease to your elbow, okay? But heavy chores, cycling, dancing, when they are doing praise and worship, and I just, it's an opportunity. Praise and worship is about 30 or 45 minutes. Yes, the remaining 45 minutes of the week, I'm going to do it in church, right? As you are giving God thanks, you are exercising your body. So you see that when the Bible says you should praise God, God knows what you're saying. God knows. Okay, so other types of exercise, cardio, running, jogging, swimming, skipping. Then you have strength training where you are carrying heavy weights. For you, those of you that can go to gym, please don't carry heavy weights alone. Please make sure you have someone supervising you. It can go wrong. Push-up, all right. Yeah. So, like I said before, there are specific exercises for specific goals. For people who want to lose weight, for example, there's what we call HIIT. I can't go into detail, but HIIT is beautiful for people who are trying to lose weight. It's one of the things we discuss on my channel. So general principles now. Know your numbers. Know your blood pressure. The range, alright? People always say, I checked my blood pressure 5 years ago and it was okay. What is the blood pressure this month? At least. Alright? And generally, what's the range? So it's usually between 120 and 130 over. Because there are two values, there's one on top and there's one under. People often say, oh, my blood pressure is 150. And what of the one under? Because if either of them is high, it's a problem, right? So both of them need to be kept in check. So know your numbers, know your BP, know your sugar level, right? Just check. Know your BMI. One reason why you should know your BMI is you will know whether you are the right weight. Alright, and that's something I also do on my community. I will help you know if you are the right weight you should be, or if not, what your target weight should be. So people often try to lose weight and they are just struggling. How much weight do you want to lose? You don't even know. After a while, they just get frustrated and give up because all they're expecting is that they will go from this to this overnight. It doesn't work like that. So if you know what the target should be, then you can, it helps you focus, alright? So lose weight if you need to lose weight. Watch your belly fat. For belly fat, I always tell people it's very simple. Except you are pregnant, if you stand like this and look down, you should see your legs. So if you are looking down and you are not pregnant but you cannot see your leg, there is a problem. There is a problem. So I tell you, stand, look down. If you cannot see your legs, it's an issue. Alright? So that's a sign that you need to adjust because belly fat by itself causes another set of problems. Alright, so watch that. So control your blood pressure, keep it below 130/85. Control your blood sugar. Of course, that one using drugs or see your doctor. then avoid overuse of any drugs. And it's common in this part of the world. You just ask someone, you have stomach pain that day, what do you think? When you bring it, let me take two. How? You just assume that it's the same kind of stomach pain, right? And this is also common with pain medication. So the second cause of ulcer is a group of drugs we call NSAIDs, ibuprofen, diclofenac. They are in that class. So anytime you have pain and you see a doctor, all right, and you have ulcer, let the doctor know, I don't take drugs like ibuprofen. So the doctor will know all the other drugs in that class not to give you because it causes ulcer. Because ulcer when people use it for a long period of time, and it's a bit more common in ladies due to menstrual cramps. That's something to keep in mind. Drink water, 2 to 2.5 liters. That's basically 3 to 4 bottles of water per day. All right. If it's pure water, 4 to 5 sachets of pure water per day. All right. That's how much water you should drink. That is you just helping your kidneys to do their work very well. All right. Generally, in medicine, when we look at your urine, we can easily tell if you are having kidney problems. It can give us a hint, you can put it that way, all right? Because expecting that you are drinking the right amount of water, there is a way your urine should come out. Now, if you are not drinking the right amount of water, you are basically forcing the kidney to work under abnormal conditions. And already once you check your urine, you will see that you are not drinking enough water, especially if your urine is very dark. Okay, that's a sign that you need to drink more water. And I'll probably also say, doctor. So wash your hands frequently, keep a face mask handy, always keep a face mask with you. You don't know when you enter a bus and someone is coughing and trying to share something with you that you did not ask for. So that kind of situation, you can get a face mask, or if you can politely give them the face mask. Don't say it with anger. Don't just, if not, just cover your face, and yes, cover your face without any apologies, so that you do not collect what does not belong to you. Yes. So reheat cold food, wash your fruits and vegetables properly. Okay, yeah, so 3 points I'm going to talk about. I had this friend, he will take food. He can smell that the food is about to spoil. He will just say, this food is about to go. It's about to go. Let me warm it. He will warm it and eat. Right? That's bad. Why? Because the organisms in there, by the time you consume that food, put you at risk of having all sorts of infections. And then the person starts vomiting and passing watery stool. Vomiting and passing watery stool can be so dangerous, especially as you get older, because the body system is not that strong. Alright, so you want to avoid it. If food is bad, don't throw it away. It's fine, let it go. Avoid unsafe practices. Then when they were saying don't do blood covenant, you thought it was spiritual. You do blood covenant, you collect HIV or hepatitis, you will see where you will land. Alright, so please avoid unsafe practices, sharing sharp objects, and the rest. Avoid marriage without genotype. Love is no longer blind, right? Oh, as one pastor said, love is blind, marriage will open your eyes. Yes. So whichever one it is, do the genotype. Alright, it's just yes, no. Alright. Immunization for ladies. So what I have here is that we do HPV, right? Human papillomavirus, HPV immunization vaccines for ladies. Okay, so if you haven't gotten that, see your doctor and get that. It helps in the prevention of cervical cancer. However, of course, for women who are already sexually active, you need to first of all be screened before you get the vaccine, because if you are sexually active and you've already gotten the vaccine, you've already gotten the HPV infection, then the vaccine can't really do much. So get screened and check that out. And I think I'm about my last slide. So a healthy life is not a destination, it's a journey, and every day you take a step, either backwards or forwards. Your body is changing. If you don't do anything, you won't be able to keep up with that change. And if your body is moving and you're not keeping up, then you're going back. So you need to be taking steps every day. Lastly, so for those, my Dr. Macx Health Support Community, we help with weight loss support, blood pressure, education, blood sugar support. I answer questions generally, medical questions, whatever it might be, even outside these common topics. And it's just a community for people who want to be healthy. So for anyone who wants to join that community, that's the phone number there. You can send a message that you want to join, and it's free. Nobody's selling anything to you. It's just helping you stay educated. All right. And now I'll take questions.
Hallelujah. Let's clap for Jesus. That's a wonderful section. How many of you enjoyed the section? Let's clap for Jesus. Okay, so really appreciate you and thank you for this insightful teaching. We have a couple of questions and I would just want to at least just have to answer them just so how we can benefit from it. But before then, one of my colleagues just asked me that is teaching as a teacher, teaching the children, is it part of exercise?
So if you are running up and down with them, yes. But if you are they just sit down and teaching them now, it's not enough activity.
Okay, so let me just run through the question. Should I just run through or just answer the one after the other?
Yeah, I'll answer one.
Okay, he said, sir, somebody who put, should I answer? Okay, let me answer. Somebody who puts weed in his or her food because he's not smoking, is it, what's the effect? I think that's what the question is.
Oh yeah, it's like I told you, it's psychoactive. No, it stops your brain function. So yes, it's not healthy. It eventually is going to cause a problem. Like, it's a gamble, right? So let me put it this way to you. I tell you that when I was in school, there was someone who fell from the last story building, the last floor, the 4-story building. He fell. This guy did not have a scratch, right? No scratch, nothing. And when Lutz, they took him to Lutz. When they told the doctor what happened, the doctor said, no, we can't take him. Someone that was standing in front. Because they were feeling like, maybe this guy will still die after. But it was fine. So today it's fine, right? How many people would like to try the same thing? So that's the gamble. When you take psychoactive substances, some people would actually take those things and nothing will happen for some reason, right? But it's a gamble. You can also do the same and then you end up with problems. So it is always a very high risk of developing mental problems.
You said eating outside can also cause ulcer. My question is, in a situation whereby you don't eat out and your space is clean and you still have ulcer, what can cause that?
Yeah, so like I said, NSAIDs is the other one, and also you might not be eating out now, but when you were a child, you went for a birthday party and the infection was in the food. Like I told you, ulcer, the infection can be quiet in your system for years, causing a problem. Now, unfortunately, sometimes even after you kill the infection, so there's a treatment course that we give. After you kill the infection, for some people, the ulcer itself, I told you, is making a hole in the stomach. So the hole hasn't gone, all right? You killed the infection, and so the person will still feel that pain, all right? So what you need to look out for is triggers. What triggers it? For some people, it's Coke, soft drinks. For some people, it's rice. For some people, it's orange. So know the thing that triggers that ulcer pain and just avoid it, as long as you've treated the infection.
Please, if one wants to handle it, what are the necessary meals for that person to be taken?
Okay, so for people who want to add weight, I'm usually very hesitant to answer that question because I need to know what is the problem in life that you are not adding weight. That's where we need to start. Is there a problem? Is it that you are not eating well? We need to know why you are underweight, and you actually have to be underweight because I'm not here to make you look robust, and give you that, young people today call it, I want to look thick, I want to have curves. That's not the job of a doctor. My own is if you are underweight, I will treat the problem why you are underweight so that your weight can come to normal. That's what I do. So we identify the reason why you are underweight, and then we treat that. That's what we do.
Okay, the next question is, what steps can one take to prevent being a victim of medical errors, such as wrong diagnosis, wrong treatment, doctors and misuse wrong treatment, doctors and misuse of, or mistakes, let me use that word, misuse of mistakes.
Okay, you can pray, yes. That's what you can do, you can pray, because it happens in all parts of the world. Now, aside that, I always like to say, if you have a doctor friend, keep that person's phone number close, right? You ask them, I want to see a doctor, which hospital do you recommend? Because not every hospital that says something and something hospital even is registered with Lagos State government. Some of them who now say they are registered with Lagos State government, you are going there and you are seeing the cleaner. They give the cleaner white coat to wear and put stethoscope on the cleaner's neck, and the cleaner has learned one or two things. And that's that person will attend to you, right? So there is no clear-cut way, but getting recommendation from someone you know is a doctor or a certified nurse would put you in the best possible situation. Yeah.
Okay, thank you, sir. This one is very interesting. Cause of heartbeat going too fast during sex.
It's exercise now. It's also a type of exercise. Like asking me why your heart is going too fast if you start jumping or dancing. It's exercise. Are you not moving your body? Yeah. So, and yes, sex is actually also a type of exercise. The only problem is, I told you it's 150 minutes per week. I don't know how you hit that target, but to an extent, it's also exercise. So that's why your heart is going too fast. However, if you start noticing chest tightness, or you can't breathe, or you feel like you're going to faint when your heart is beating very fast, please stop first. Just stop. And stop there. Go and see your doctor.
In addition, we need the confines of marriage. Hallelujah.
Yes, we need the confines.
Please, sir, is it all fruits that are good for our health? Because some fruits are sugar, very, very sweet.
Yeah, so this is something I still discussed about 2 weeks ago on my YouTube channel. There are certain fruits that have what we call a high glycemic index. It is most relevant for people dealing with diabetes, all right, because they are the ones who are, most concerned about how the sugar goes up. So if you're not dealing with diabetes, please eat any fruit you want to eat. Of course, in some moderation, but there's no food that is a problem. But if you're dealing with diabetes, then you need to discuss with the doctor. And on the group 2, I also posted 1 or 2 things to help people dealing with diabetes know the kind of fruits that will be helpful. So when you join, you will see that.
Thank you, Doc. Sir, please elaborate more on the consequences of taking coffee at work, especially for 9 to 5 workers who take it to remain awake and active at work.
Yeah, so coffee is a stimulant, like I told you. It tells your brain, fire. And you cannot keep doing that every day, right? Because it's going to create problems, okay? So coffee is one of those things you just have to restrict. Because of the fact that it's telling your brain to fire, your brain is going to tell your heart to fire. When your heart fires, what will happen? Your blood pressure will go up. So you keep doing that very often, every day, then it's a problem. Coffee should, in fact, probably be completely avoided in people who have high blood pressure.
Thank you, sir. Sometimes when I caution my children about consuming too much sugar, my wife will oppose me. She will say that children need sugar. Please, is that right?
To an extent, yes, children need more sugar than adults, right? So that is a fact because of the fact that they use it. However, look at your child. When you see your child, you will know whether this child should take more sugar or not, right? There is that. Another thing is, by that I'm talking about the weight of the child already. You should know that. But another thing is moderation, right? Taking ice cream once a week, once in a while, that's fine for children. But every day, one juice or ice cream or something, no, that's too much. It can't be every day. Okay. All right.
Thank you. We have 4 more to go. So just briefly. So how can someone above 40 stay freshened up facially? Resting well, eating right, stressful work is checked. Can supplement work? Which one do you subscribe?
Okay, so for supplements, the logic is, what are you supplementing? Because something has to be deficient for you to supplement it. So what do you think you are missing? For women, of course, that's very understandable. Women often have a low calcium, especially when they start to get towards menopause. So a lot of women have to take calcium supplements if they notice that their calcium levels are low, right? But generally speaking, if you are eating well, no, you don't need to supplement anything, all right? But if you've seen a doctor and they're telling you something is low, then of course you need to supplement that.
Okay, so supplement like vitamin C, that vitamin C that you take, that will put inside water.
Yeah, so that almost does nothing. Yes, it's nothing. You are just drinking it because you feel like drinking something.
Oh, so it's not healthy too?
It's not that it's not healthy, but it doesn't particularly have any benefits per se. It's like, I would say that, yeah, so I would say immunity level.
Just to boost your immunity level.
Yes, unless something is wrong with your immunity level.
Oh, okay.
Yeah, So if you are eating well, you are resting, there should be nothing wrong with your immune system. Also, everything your body needs to properly function is gotten from food, so you would not need supplements.
Okay, thank you, sir. So what if you want to sleep early and the sleep does not come at all? What do you do, sir?
Yes, so,
sir.
Okay.
Lay more emphasis on plantain or ripe oats.
Oh yes, unripe plantain is good. All right. For people who are trying to cut down on sugar, unripe plantain is fine. However, if you eat unripe plantain with rice, you won't enjoy it. That's just the truth, but what it is. So for sleep, you need to train your body on how to sleep, right? And this is what I recommend. Pick a time when you will always lie down. At this point in time, no TV is on, your phone is off, there is no loud noise, you've turned off the lights, everywhere is cool, and you're just getting ready to sleep. If you do this continuously, over a period of about 1 to 2 weeks, your brain will start to learn that when it's this time, it's time to sleep. So you need to train your body. However, for people who are having difficulty with that, then you might want to see a doctor. They might help you with sleeping pills to start the training. And after a few days, you stop the pills because your brain has now been trained. So.
Okay, so someone asked a question. What can attribute obesity? As a doctor, can you also attribute obesity to hereditary or genetics and not just quantity or quality of food? So some people eat just anything and they are okay. The two part says, in case of hypertension, if the patient takes no salt and still get a BP still at 150/90.
All right, so these two things, hypertension and obesity, they are multifactorial. So for the obesity, yes, there could be the role of genetics in there. Okay, that said, you need to ensure that you have checked off all the other boxes. A lot of time, people who complain about genetics, I look at what they are eating. I look at just take stock of what you've eaten over the last 1 week. You will know whether it's genetics or not. All right, so there's that. So you look at all the factors, and then if everything has been checked out, we also even have medical evaluation you should do to check that it's not some medical condition before we finally say, okay, this is probably genetic. Right, so there are a lot of boxes to tick. And the same thing for high blood pressure. So if the BP is still high after cutting off salt. So cutting off salt is good, but it might not be enough by itself. There are other boxes to check. That said, when you cut off salt, you have reduced the severity of the high blood pressure. So it's still a good thing to do.
Okay, lastly, what do we eat with the current situation of this country in order to balance our health? So, number 2, can't the government stop the manufacturer from producing these products that damage our health?
Okay, yeah. So if you've been watching the news, NAFDAC is really trying their best. They are cracking down as much as possible. That said, we know our country, Nigeria. You give someone 20K, you give someone 50K, they will carry their face, right? So there's that issue. That's where the government, there's not much anybody can do for now. Okay? So I'm just going to leave it there, because if I start speaking about the government, the one that is doing me will not live here. The other part of the question was,
what can we do to stop the
Yes, so for, I think it was about what we can eat in this country.
Yeah, in this country.
Yeah.
Sure, balance that.
Yeah. Like I said, you want to do more protein, and a simple source of protein. So this is even something I discussed on my community about 3 weeks ago. I brought out a full schedule of types of foods that you can eat that are easily available, right? But the bottom line is this. We're not saying put away carbohydrates. We're saying if you want to eat rice, small rice, right? Put maybe 2 eggs in there, put vegetables, and if you can add fish. All right. So what's happening is that you are filling yourself more with the vegetables and the eggs and the fish and the protein than the rice itself. Same thing for pounded yam or amala, whatever it is. All right. Just want to make sure carbohydrate is the smallest and you have more protein. And I also talked about some other sources of protein in that video.
Thank you so much, sir. The last one is that how often can one go for medical checkup?
Okay. Yes. So quickly. For your blood sugar and your blood pressure, if you don't have any history of either of them being high, for blood sugar, once a year is fine. All right, once a year is fine if it has never been high before. For blood pressure, once in about maybe 4-5 months is fine if you don't have any history of it being high. But if your blood pressure has been high in the past, at least twice a week, you must check. That's given that the BP is normal, at least twice a week. But for the blood sugar, if it has been high in the past, then at least once a month, just to check regularly. All right. So, but for a general checkup where you don't have any particular issues, just once a year is fine. Once a year is fine.
Thank you so much, Pastor. Really appreciate it. Oh, I'll say Pastor.
Thank you.
Thank you so much. Thank you so much. And really appreciate you, sir. God bless you so much. Let's just stretch our hands. So, why am I